High blood pressure, also known as the silent killer, can damage your heart, brain, and kidneys without showing any symptoms. But there's one critical mistake many people make, and it could be deadly. Let's uncover what it is and how you can take charge of your health. High blood pressure, medically referred to as hypertension, occurs when the force of blood against the walls of your arteries remains consistently elevated. Over time, this increased pressure can cause damage to your arteries and organs, making it a leading risk factor for serious health issues, including heart attacks, strokes, kidney disease, and even vision loss. Hypertension is often called the silent killer because it typically doesn't present any noticeable symptoms until significant damage has already been done. Many people are unaware they have high blood pressure until they experience a life-threatening event, such as a heart attack. This is why understanding the condition and actively monitoring your blood pressure are vital for maintaining long-term health. Blood pressure is measured in two numbers: systolic, the top number, and diastolic, the bottom number. Systolic measures the pressure in your arteries when your heart beats, while diastolic measures the pressure when your heart rests between beats. A normal blood pressure reading is typically around 120/80 mmHg, while a consistent reading of 130/80 mmHg or higher is considered hypertension. The causes of high blood pressure vary. Lifestyle factors such as a diet high in sodium, lack of physical activity, excessive alcohol consumption, and smoking are significant contributors. However, genetics, age, and certain medical conditions like diabetes or kidney disease also play a role. Unfortunately, untreated high blood pressure sets the stage for progressive damage to vital organs, as it forces the heart to work harder, leading to thickened heart muscles, stiff arteries, and reduced blood flow. While hypertension is a serious condition, the good news is that it's manageable. Early detection and intervention are crucial in preventing complications. Regular blood pressure screenings, especially for individuals over 40 or those with a family history of hypertension, can help identify the problem before it escalates. Education and awareness about high blood pressure are the first steps in taking control of this silent, yet deadly condition. One of the deadliest mistakes people make when dealing with high blood pressure is underestimating its severity and failing to stick to a proper management plan. Many individuals assume that once their blood pressure is controlled with medication or lifestyle changes, they can ease up on their efforts. This inconsistency, often fueled by the absence of noticeable symptoms, can lead to a false sense of security and devastating consequences. A common scenario involves patients discontinuing their prescribed medication because they feel fine. However, hypertension is a chronic condition that requires consistent management. Stopping medication abruptly can cause a dangerous spike in blood pressure, significantly increasing the risk of a heart attack or stroke. Even if you're asymptomatic, elevated blood pressure continues to damage your arteries, heart, and other organs in the background. Another critical mistake is neglecting to monitor blood pressure regularly. Many people rely solely on annual doctor visits to check their levels. However, blood pressure can fluctuate due to stress, diet, or other factors, making home monitoring an essential part of a successful management plan. Affordable home blood pressure monitors are widely available, allowing individuals to track their numbers consistently and share data with their healthcare provider. Dietary habits are another area where many people falter. While reducing sodium intake is widely recognized as important, hidden sources of salt in processed foods often go unnoticed. Additionally, a lack of potassium-rich foods like fruits and vegetables further exacerbates the problem, as potassium helps counteract the effects of sodium on blood pressure. Over-reliance on quick fixes, such as over-the-counter remedies or herbal supplements without consulting a healthcare provider, can also be risky. Finally, some people believe that once they've adopted a healthier lifestyle, such as exercising more or eating better, they no longer need medication. While lifestyle changes are vital for controlling blood pressure, they often complement rather than replace medical treatments. Consistency in both lifestyle and medication is key to keeping hypertension under control. Avoiding these common mistakes requires education, vigilance, and a commitment to long-term health. Partnering with a healthcare provider to create and stick to a comprehensive plan can dramatically reduce the risks associated with high blood pressure. High blood pressure has earned its reputation as the silent killer because it rarely causes symptoms until severe damage has occurred. This makes early detection and awareness critical to preventing life-threatening complications like heart attacks, strokes, or kidney failure. However, while hypertension often goes unnoticed, certain subtle signs can sometimes signal a problem, and recognizing them could save your life. One of the most overlooked symptoms is persistent headaches, particularly in the morning. While headaches are common and often harmless, those caused by elevated blood pressure tend to feel more intense and are usually located at the back of the head. They occur due to increased pressure in the brain's blood vessels, a red flag that should not be ignored. Another potential warning sign is dizziness or lightheadedness, especially during physical activity or after standing up quickly. This can indicate that your cardiovascular system is under stress, struggling to maintain proper blood flow. Chronic fatigue, difficulty concentrating, or memory issues may also result from reduced oxygen supply to the brain caused by high blood pressure. Blurry vision or episodes of sudden vision loss can occur when hypertension affects the tiny blood vessels in your eyes. This condition, known as hypertensive retinopathy, can progress to permanent damage if left untreated. Shortness of breath, chest pain, or an irregular heartbeat may signal that hypertension is impacting your heart, increasing your risk of developing heart failure or other cardiac conditions. More advanced stages of hypertension can also lead to swelling in the legs, ankles, or feet. This happens when the heart struggles to pump blood effectively, causing fluid to accumulate in the extremities. Nosebleeds, while less common, may occur due to the increased pressure on delicate blood vessels in the nasal passages. While these symptoms can sometimes provide a warning, many people with hypertension experience no signs at all. This underscores the importance of regular blood pressure checks, even if you feel perfectly healthy. Catching high blood pressure early allows for interventions that can prevent long-term damage to vital organs. If you recognize any of these symptoms, or simply haven't had your blood pressure checked recently, it's crucial to consult a healthcare provider. Early action can mean the difference between silent progression and effective management. Managing high blood pressure is not just about taking medication. It requires a holistic approach that includes diet, exercise, and stress management. These lifestyle factors play a significant role in controlling hypertension and preventing its dangerous complications. A balanced diet is one of the most effective ways to lower blood pressure. The dietary approaches to stop hypertension, DASH. Diet is highly recommended for individuals with hypertension. It emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy, while limiting sodium, saturated fats, and added sugars. Reducing sodium intake is critical, as excess salt causes the body to retain water, increasing blood volume and pressure. The World Health Organization recommends consuming no more than 2,300 milligrams of sodium per day, which is roughly 1 teaspoon of salt. However, many processed and packaged foods are loaded with hidden sodium, so reading labels and cooking at home with fresh ingredients can make a big difference. Incorporating potassium-rich foods like bananas, oranges, spinach, and sweet potatoes helps balance the effects of sodium, as potassium relaxes blood vessels and aids in excreting excess sodium from the body. Additionally, foods high in magnesium, such as nuts, seeds, and legumes, contribute to improved vascular health. Regular exercise strengthens the heart, improves circulation, and helps maintain a healthy weight, all essential factors in managing blood pressure. Aerobic activities like walking, jogging, swimming, or cycling are particularly effective in lowering systolic and diastolic blood pressure. Aiming for at least 150 minutes of moderate intensity exercise per week is a good target. Strength training can also benefit those with hypertension by improving muscle tone and boosting metabolism. However, individuals should consult their healthcare provider before starting an exercise program, especially if their blood pressure is severely elevated. Chronic stress can lead to temporary spikes in blood pressure and unhealthy coping mechanisms, such as overeating, smoking, or excessive alcohol consumption. Learning to manage stress is a crucial part of hypertension control. Mindfulness techniques like meditation, deep breathing exercises, and yoga have been shown to reduce stress and promote relaxation. Engaging in hobbies, spending time in nature, and maintaining social connections also contribute to mental well-being. Avoiding excessive caffeine, which can cause temporary increases in blood pressure, is another practical step. Together, diet, exercise, and stress management create a powerful foundation for controlling blood pressure naturally. While these changes may not replace medication for everyone, they can enhance its effectiveness and improve overall health. Consistency is key. Small, sustained efforts can lead to significant long-term benefits. Managing high blood pressure effectively begins with seeking guidance from healthcare professionals. Regular consultations provide the foundation for monitoring, diagnosing, and addressing hypertension before it causes irreversible damage. Yet many people delay or avoid medical attention either due to lack of awareness or the absence of noticeable symptoms, putting their health at unnecessary risk. Routine blood pressure checks are a cornerstone of hypertension management. For those with elevated readings or a family history of high blood pressure, monitoring should be more frequent. Healthcare providers use these readings to identify patterns and tailor a treatment plan that suits individual needs. Home monitoring devices are also valuable tools, enabling patients to track their blood pressure daily and share accurate data during medical visits. Once hypertension is diagnosed, treatment typically involves a combination of lifestyle adjustments and medications. Prescribed medications vary depending on the severity of the condition, but common options include diuretics, ACE inhibitors, beta blockers, and calcium channel blockers. These medications work in different ways, such as relaxing blood vessels, reducing heart workload, or flushing excess fluid from the body. It's crucial to take these medications exactly as directed, and discuss any side effects with your doctor to ensure optimal results. For some patients, treatment may also require managing underlying conditions like diabetes, high cholesterol, or kidney disease. Addressing these contributing factors can significantly improve blood pressure control. Open communication with your healthcare provider is essential. Don't hesitate to ask questions or express concerns about your treatment plan. Additionally, healthcare professionals can guide you through lifestyle changes that complement medical treatments. Personalized recommendations for diet, exercise, stress reduction, and weight management are often provided to ensure long-term and deep success. These adjustments, when combined with consistent medical supervision, form a powerful strategy to combat hypertension. Ignoring or delaying professional care can result in severe complications, such as heart attacks, strokes, or organ failure. By taking a proactive approach and maintaining a partnership with your healthcare team, you can reduce these risks and live a healthier, more balanced life. Hypertension may be a silent condition, but its impact doesn't have to be fatal when managed correctly.